If you've been dealing with bloating, gas, brain fog, skin issues, fatigue that doesn't respond to sleep, and you've been told your labs are normal, I need you to listen closely, because what you're experiencing isn't in your head, it's in your gut. And more specifically, it's a condition that most conventional doctors don't even test for, called intestinal permeability, or as most people know it, leaky gut. I'm Dr. John Kim, Board Certified Pharmacist turned functional medicine expert. And over the last decade, I've worked with thousands of patients who were told their digestive issues were just IBS or anxiety or stress. But when we ran the right tests, we found the same pattern over and over again. A compromised intestinal barrier, allowing toxins, undigested food particles, and bacteria to leak into the bloodstream. And you need to watch this full video, because the solution isn't another prescription. It's a protocol that addresses the root cause of your symptoms. Let me explain what's really happening inside your body. Your gut lining is one cell thick. That's it. One single layer of cells called enterocytes, held together by something called tight junctions. Think of it like the grout between tiles. When that grout breaks down, things that should never enter your bloodstream suddenly do. This is leaky gut. And it's not some alternative medicine theory. It's a clinically recognized condition called intestinal hyperpermeability. And here's what most doctors miss. Leaky gut isn't just a digestive problem. It's a systemic problem. When those tight junctions break down, your immune system goes into overdrive because it's detecting foreign invaders in places they should never be. This triggers something called systemic inflammation, and that inflammation shows up as brain fog because inflammatory cytokines cross the blood-brain barrier. Acne and eczema because your skin is trying to detoxify what your gut can't contain. Joint pain because those same inflammatory markers attack your tissues. Autoimmune flare-ups because your immune system starts mistaking your cells for the enemy. And here's the truth that will change everything for you. Until you heal that gut lining, nothing else will work long term. Not the probiotics, not the digestive enzymes, not the elimination diets, because you're trying to build a house on a foundation that's crumbling. And by the way, if you're watching this and thinking, finally, someone is speaking my language, hit that subscribe button right now. Because we are building a movement of people who refuse to accept Band-Aid solutions. And I want you to be part of it. Now, let me walk you through the exact 4-step protocol I use with my patients to heal leaky gut from the inside out. This isn't theory. This is clinical practice backed by peer-reviewed research and real patient outcomes. And I need you to understand something critical before we dive in. This protocol works in sequence, meaning you can't skip steps, you can't cherry pick, and you can't rush the process. Healing the gut lining takes time, usually 12 to 16 weeks minimum, but when you do it right, the results are profound. So let's get into it. Step 1, remove. This is where most protocols start, and it's non-negotiable. You must remove the things that are actively damaging your gut lining. And there are 3 major categories here. First, inflammatory foods. Gluten is the big one. And I don't care if you don't have celiac disease. The gluten contains a protein called gliadin that increases something called zonulin, which is the molecule that literally opens up those tight junctions. One study published in the journal Gut showed that gliadin increases zonulin in everyone, not just celiacs, meaning gluten makes your gut leaky whether you have a diagnosed sensitivity or not. Dairy is next, specifically A1 casein, which triggers inflammation in a huge percentage of the population. Processed seed oils, these are inflammatory at the cellular level, damaging not just your gut, but your mitochondria. And refined sugar, which feeds pathogenic bacteria and yeast, creating an environment where the bad guys thrive. Second category, infections. You need to test for parasites, bacterial overgrowth like SIBO, and fungal overgrowth like Candida. These pathogens produce toxins that directly damage the gut lining, and until you clear them, you cannot heal. I use comprehensive stool testing with every single patient because you can't treat what you don't measure. Third category, chronic stressors. NSAIDs like ibuprofen, these are known to cause intestinal permeability. Even the package insert warns about it. Antibiotics, which wipe out your beneficial bacteria, leaving your gut vulnerable. And alcohol, which is directly toxic to the gut lining. This removal phase typically lasts 4 weeks minimum, and I know it's hard, but it's essential. Step 2, replace. Once you've removed the offenders, you need to replace what your gut is missing to digest food properly. Because here's what happens with leaky gut. Your body stops producing adequate digestive secretions. Stomach acid, pancreatic enzymes, bile, all of these decline. And when you can't break down food properly, you create more inflammation, more undigested particles, and the cycle continues. So we replace with betaine HCl with pepsin to restore stomach acid, because low stomach acid is epidemic in people with gut issues. And I know this contradicts what you've been told about acid reflux, but most reflux is actually low acid, not high acid. The research is clear on this. Digestive enzymes, specifically a broad spectrum blend that includes proteases, lipases, and amylases to break down proteins, fats, and carbs, ox bile, especially if you've had your gallbladder removed or if you have trouble digesting fatty foods. This step runs concurrent with removal, meaning you start this immediately. And here's what patients report within the first 2 weeks: less bloating after meals, more regular bowel movements, and less brain fog. Because now, food is being broken down properly instead of sitting in your gut and fermenting. Let me pause here for a second. If you are tired of being told your labs are normal when you know something is wrong, hit that subscribe button. We are building a community that demands real answers, not just prescriptions that mask symptoms. And I want you to be part of it because what I'm teaching you today is what changed my entire medical philosophy. All right, let's keep going. Step 3, reinoculate. This is where we rebuild your microbiome, the trillions of bacteria that should be protecting your gut lining. But here's the mistake most people make. They take a random probiotic from the drugstore and hope for the best. That doesn't work. You need specific strains at therapeutic doses, and you need to feed them properly. So here's what I use: Lactobacillus rhamnosus, GG, clinically shown to strengthen tight junctions. Saccharomyces boulardii. This is a beneficial yeast that crowds out candida and supports immune function. Bifidobacterium longum, which reduces inflammation and supports the gut-brain axis. Doses matter. We're talking 50 to 100 billion CFUS daily during the healing phase, not the 1 billion you get in most commercial products. And then you need prebiotics, which are the fibers that feed your good bacteria. Partially hydrolyzed guar gum, also called PHGG. This is gentle and well tolerated even in sensitive guts. Resistant starch, like cooked and cooled potatoes or green banana flour. And fiber-rich vegetables. Once your gut can tolerate them, this phase runs for at least 8 weeks because it takes time to shift the microbial ecosystem. Step 4, repair. This is where we give your gut lining the raw materials it needs to rebuild those tight junctions. And there are 5 key nutrients that are non-negotiable. First, L-glutamine. This is the primary fuel source for your enterocytes, those gut lining cells we talked about earlier. Doses range from 5 to 20 grams per day, and the research shows it significantly reduces intestinal permeability. Second, zinc carnosate. Zinc is essential for tight junction integrity, and the carnosate form is specifically studied for gut healing. Third, collagen peptides. Your gut lining is made of collagen, and supplementing with it provides the amino acids needed for repair. I recommend 10 to 20 grams daily. Fourth, omega-3 fatty acid, specifically EPA and DHA from fish oil. These are anti-inflammatory at the cellular level and support membrane integrity. And fifth, polyphenols, compounds like quercetin, curcumin, and resveratrol, which reduce inflammation and support healing. This repair phase runs for the entire protocol, minimum 12 weeks, and often longer depending on severity. And here's what I see clinically when patients follow this protocol. Energy returns, brain fog lifts, skin clears, and they finally feel like themselves again. Now, if you're watching this and thinking, I need help implementing this, I want you to know, you don't have to do this alone. My team and I work with patients virtually, running the right labs, customizing protocols, and guiding you through every step. If this resonates with you, don't guess with your health. Click the link below to book a discovery call with my team. We'll review your case and determine if you're a fit for our program. Or, if you want to go deeper into gut health, watch this video next where I break down exactly how to interpret your stool test results. Look, I know this protocol seems overwhelming, but here's the truth. Your body wants to heal. It's designed to heal. You just have to remove the obstacles and give it the right support. And when you address the root cause, not just the symptoms, everything changes. I've seen it thousands of times, and I know it can happen for you too. I'm Dr. John Kim, and I'll see you in the next video.